Hi, my name is Francesca Vallejo, and today we will be talking about the mental health care crisis in America. So to begin, I will be discussing further about the problem and what makes this problem social. So the social problem that will be of main focus is the mental health care crisis in the United States. The mental health services in the U.S. is not only broken, but also failing many Americans seeking help for their mental health issues. It is apparent that there needs to be improvements made within the American mental health care systems in order to give Americans the necessary access needed to obtain mental health services and receive the care they so desperately need. So what makes this problem social? As mentioned by Mooney, Knox, and Schott, a social problem is a social condition that a segment of society views as being harmful to society and is in major need of remedy. The mental health care crisis in America is considered as being a social problem since there is a significant amount of Americans that are suffering from mental health issues and are struggling with the inability of finding care and access to mental health services. For example, multiple mental health treatments remain largely unaffordable to many Americans, especially those from disadvantaged or lower socioeconomic groups. According to Zhuo and Cheng, there are over 19 million Americans suffering from mental health problems every year, and roughly 1/4 of the U.S. population lacks adequate access to mental health care services. This information further clarifies that this problem is a social problem since it is affecting many members within society and is in need of immediate action to be taken to improve the mental health care systems in America. So on to some causes and contributing factors to this social problem. So it is of great importance to understand the underlying causes and contributing factors of this social problem. One of the causes behind the mental health care crisis is due to the effects of deinstitutionalization. As mentioned by Mooney et al., deinstitutionalization refers to the process of removing individuals with psychiatric disorders from large residential institutions and mental hospitals to outpatient community health care centers. As a result, this has made inpatient services incredibly limited and has forced those that are chronically mentally ill to be treated in outpatient settings. Mooney et al. Stated that the community mental health programs have not been able to adequately meet the standard for care, which has caused millions of Americans with mental illnesses to go without needed care. According to Llanos, Knight, Vaishankar, Gonzalez, and DeLuca, community mental health providers may sometimes perceive themselves as being agents of law enforcement, causing their treatment to become cop-like, therefore increasing the chances that their clients will not build a genuine rapport with them. This can cause those who suffer from mental illnesses to avoid mental health services altogether and prevent them from receiving the care that they so desperately need. Another contributing factor to this social problem is the low reimbursement rates in the private insurance sector. For example, since many psychiatrists were poorly reimbursed for their services, many were unable to stay in practice because of the minimal payments and rising costs. As a result, many psychiatrists had to stop accepting government insurances, and patients suffering from mental health problems now had to deal with high out-of-pocket costs, which made treatment costly and unaffordable. In addition, the stigma with mental illness is another contributing factor to this social problem. For example, the stigma associated with mental illnesses has contributed to the lack of patients receiving mental health care services. In today's society, mental illness has become synonymous with the dangers and violence that occurs within society, for example, mass shootings. As a result, those suffering from mental illnesses may fear judgment by the stigma against those who suffer from psychiatric disorders and may become disinclined to seek treatment. As mentioned by Mechanic, people suffering from serious mental health problems have remained the most stigmatized and neglected within our mental health services system. Now, these are some consequences that have resulted from this social problem. There have been multiple consequences that have resulted due to the social problem. One of the consequences resulting from the broken mental health care system in the U.S. is the high cost of mental health care services. Many individuals suffering from mental illnesses cannot afford treatment due to the high cost and insufficient insurance coverage. As a result of these issues, this prevents a great amount of individuals from accessing mental health care. For example, those that come from lower socioeconomic or disadvantaged groups are not able to afford mental health treatments. Due to the high cost of mental health services, this can also cause individuals to experience a significant amount of medical debt. As mentioned by Mooney et al., medical debt refers to the debt that results when individuals cannot afford to pay their medical bills. Previous research has found that 1 in 3 U.S. adults are struggling to pay their medical bills. In order to avoid getting into more debt, many individuals with mental illnesses are choosing to not seek mental health treatment. As mentioned by Braithwaite, due to the high cost of psychotherapeutic treatments, psychotropic medication, and behavioral rehabilitation, many Americans suffering from mental illnesses are unable to afford mental health services and receive the proper care that they need. Another consequence resulting from the social problem is the lack of accessibility to mental health services. In other words, there are many Americans that are not able to access mental health services. The large disparity in the accessibility to mental health care differs according to one's level of income and location. For example, mental health services are often inaccessible for those living in rural areas. In addition, individuals of lower income levels are less likely to access mental health services. According to Lake, in addition to the limited access of mental health care services, the social stigma associated with seeking mental health services is preventing many individuals with mental health problems from obtaining adequate care. The stigma associated with mental illness can not only negatively impact an individual's self-concept, but can also cause them to avoid seeking mental health services. Now for this section, I will explain who benefits and who doesn't by the persistence of this social problem. Beginning with those who may benefit by the persistence of the social problem, I believe that those who work in the medical settings, for example, psychiatrists, doctors, nurses, can benefit from this social issue. Since there is a significant amount of Americans suffering from mental illnesses, this means that there is a high demand for those seeking mental health treatment services. As a result, medical professionals do not have to worry about experiencing a shortage of jobs or lack of business. I also believe that the persistence of this social problem can, in a way, benefit the government. For example, the state and federal governments can lower the financial burdens of our country by making budget cuts, specifically financial cuts in the behavioral mental health services. This social problem urges policymakers and lawmakers to find strategies to make all healthcare services more efficient, find ways to balance the budget of our country, and focus on decreasing our country's financial burdens. There are many Americans that are disadvantaged by the persistence of this societal problem. As mentioned by Lake, elderly individuals, low-income groups, uninsured persons, and those living in rural areas are at an increased risk of not being able to obtain adequate mental health care. As a result, many individuals with mild to severe psychiatric disorders are not receiving any treatment or are receiving inadequate care treatment for their mental disorders. Those of racial ethnic minorities are also disadvantaged by the social problem. According to Cook et al., individuals that are members of racial ethnic groups in the U.S. are not only less likely to access mental health services, but are also more likely to receive inadequate care. Society as a whole is also disadvantaged by the social problem. For example, due to the significant budget cuts that have occurred among various mental health programs and services, this has significantly decreased the vitally needed mental health services for countless Americans suffering from a mental illness. Society is now left with many individuals with untreated mental illnesses, often finding themselves in homeless shelters, emergency rooms, and prisons. This can further produce a significant amount of emotional and financial burdens onto society. Now, the problem in the public. So I will be explaining who has the ability to influence social problem and how it is framed for the public. The U.S. government, including lawmakers and policymakers, have the power, money, and ability to influence public debates about this particular social problem and other societal issues. In regards to the mental health care crisis in America, U.S. government officials and policymakers have the power to set up meetings and form organizations to address the issues regarding our broken mental health care system. By doing so, this can bring more awareness to society that there is an ongoing problem that needs to be addressed and fixed in regards to our country's mental health care systems. In addition, the federal government can also work with various states to address the problems associated with the mental health care systems. This can include protecting the rights of consumers, establishing effective strategies to provide funding for mental health services, regulating providers and systems, and support research and innovation. States also have an enormous amount of power in making decisions about their current mental health systems. For example, state regulations can address the various issues surrounding the social problem, such as lack of funding, availability of treatment facilities, and disparities in mental health care settings. In addition, those in power, for example, politicians and U.S. government officials, can put forth policies that can help benefit and alleviate the issues regarding the social problem. For example, those in power can implement policies that helps make mental health treatment affordable and accessible to all Americans. As you can see, these examples demonstrate how influential the U.S. government, lawmakers, policymakers, and politicians are to this social problem. Mass media outlets play a significant and influential role in how the social problem is framed for the public. News media outlets and social media platforms can inform the public about current social problems and how it is affecting society. By doing so, this can help bring awareness out into society about social problems and can demonstrate the importance of finding a remedy to this problem. One of the problems with how media displays or frames a problem to the public is that it may not always be true and factual. For example, groups with money, power, and influence can use these advantages to fabricate and over-dramatize their messages to the public once they gain access to mainstream media. By doing so, this can take away from the true message behind a particular social problem and can make it that much more difficult to find a real solution to various societal issues. As mentioned by Parker and Bozeman, social media plays an influential role when framing social problems because it can shape the values of the public. For example, not only can social media discuss important content behind particular social problems to widespread audiences, but it can also spark in-depth conversations about the social problem in relation to public values. Also mentioned by Barker and Bozeman, research studies have found that various social media users have changed their stance on social issues because of what they have observed throughout social media platforms regarding that topic. With that being said, both news media outlets and social media platforms can significantly influence the views and opinions of the public by how they choose to frame social problems. So this section will be on the advocacy for social change. It is apparent that the U.S. is suffering from a broken mental health care system. For example, many Americans suffering from mental illnesses are not receiving adequate care or are able to access mental health care due to this broken system. Also, the lack of mental health services for those that are mentally ill are contributing to this social problem and making matters worse. Improvements need to be made in order to fix our mental health care systems and provide those suffering from mental disorders with efficient and readily available mental health services in order to give them the help they so desperately need. So solution number 1 would be improving access to mental health care. As previously mentioned, many Americans suffering from mental illnesses are struggling to access mental health services. Those from lower socioeconomic and disadvantaged groups and living in rural areas struggle the most with being able to access treatment services. It is of great importance that we are able to reduce the barriers to mental treatment access. The first thing we can do to improve access to mental health services includes recruiting more mental health professionals. More specifically, it is crucial that we recruit mental health professionals that are willing to provide services to those living in rural and impoverished communities. In addition, it is important that these same medical professionals work on building cultural competency to work with those to improve health insurance coverage for those struggling from mental illnesses. It is important that Americans find ways to address their concerns regarding the social problem to the U.S. government. For example, petitions, contacting members of Congress, voting in elections, in order for change to occur. Solution number 2, end the stigma of mental illness. When it comes to eliminating the stigma associated with mental illness, it is crucial because the social rejection and stigmatization associated with mental illness discourages individuals from seeking mental health treatment. Many Americans suffering from mental illnesses live in fear that society will judge them for seeking out mental health services. First, we can combat this stigma by putting an end to the inaccurate associations between mental illness and violent crimes. In order to end the stigma that society views mental illness as synonymous with violence, we need to address these concerns to politicians and those in government, so they can take the necessary steps needed to help put an end to the stigma. As mentioned by Mooney et al., effective anti-stigma campaigns can eradicate negative stereotypes of those with mental health problems and can also help demonstrate the positive contributions and accomplishments of people with mental illness. In addition, it is important that as a society, we join together to advocate, educate, and bring awareness to mental illness so that it can empower people to receive the help they need without fear of being isolated or judged. Solution number 3, fund and support mental health research. In order to offer effective mental health treatments and services to those struggling from a mental illness, it is important that we fund mental health research to test the effectiveness of those treatments, services, and gain a deeper understanding on how they work. Also, without research, we will not be able to learn more about mental health. Mental health research can help relieve significant distress, save lives, and improve the quality of life of those suffering from mental illness. It is also important that the U.S. funds mental health research because it can be helpful in addressing the various challenges of mental illness, including how to treat mental illnesses. The significant scientific discoveries that result from mental health research can not only change lives, but can also end the suffering of many Americans that have a psychiatric disorder. Together, we can make a change. Thank you so much for watching, and I hope you enjoyed.